Welcome, everybody. A happy new year. This is Dr. Annette Mercatante from the Clair County Health Department. And we're here a little bit off our schedule on Tuesdays, but still to bring you the opportunity to ask us questions about COVID-19. Next week, we'll be back on our regular Thursday afternoon schedule. So let's get right to the data and any questions you might have. So this is our status report for this week. As you can see, it's a little off because it's a week or, it's a few days early, but we are seeing ongoing trends of high transmission with about 100 average new cases per day, about 7 to 800 average new cases per week, and an above 20% positivity rate for testing. We have seen 22 new deaths come in the last week, so we're still seeing more than one death per day on the average. However, next slide. The good news is here's our wonky epi curve. And as you can see, after this latest increase, we do seem to be trending downward. This is certainly as well in the last 2 weeks. What the state of Michigan is reporting is a downward trending from the Delta. However, we have the concern of the Omnicron as well. I'm going to always destroy that word. It's awkward to me for some reason. Omnicron. And we are watching closely what's happening in some of our neighboring states and certainly in the north or the northeast, I believe, is where they're getting hit. So let's go on to the next slide. Our data dashboard continues to be updated regularly. Please continue to utilize this as we go into more testing, at-home testing, and things of that nature. We can assume that a lot of positive cases are not getting reported. However, this is a good way of watching trends and seeing which direction we might be going. And I just wanted to throw in a couple more slides. What do we have next? Oh, okay. We have this slide, and this is to give you some idea of the grave concern those of us in public health have as we watch the Omicron variant sweep through Europe and through parts of the United States now. It is a unique transmission curve. It's highly contagious, much more contagious than what we've dealt with before. Some of the good news may be that it's not as severe, but that might be canceled out by the sheer number of people who may get infected, as well as the concern that it could more easily infect people who've already achieved some immunity. So we talk a little bit about that more. And of course, the CDC's newly released guidelines for quarantine and isolation. Surprise to all of us, but this is what we've put together today based on the guidelines. We will get this on our website if it's not already there, and we'll spend a little time talking about it today as well. Actually, should we spend a little time talking about that now, ladies
Sure.
and gentlemen? Okay. So, the new guidelines essentially allow earlier return to activity with a case. So if you've tested positive or you're sick from COVID, regardless of your immunization status or vaccination status, we are asking you now to stay home for 5 days instead of 10 days. And I think this does follow the science. The vast majority of people are infectious in that earlier part of their infectious process. And the latter part, days 6, 7, 8, 9, and 10, there are some residual stragglers who remain contagious and are shedding virus, but it's not nearly to the extent we see earlier on. And for that reason, we want people to continue to wear a mask very strictly, a well fitting mask for the remainder of the 10 days. So you might want to think of this as the isolation period really not having changed, but because we're anticipating such a large amount of people sick at the same time, we want to make sure that our workforce and our critical infrastructure is maintained. And so a 5 day period of absenteeism instead of 10 is now being endorsed. Now, this is only if you're not having symptoms. If you're sick, we want you to remain home, particularly with fevers and things of that nature. So, this is primarily an adjustment for those people who've been tested positive and are feeling pretty darn good. Rather than staying home 10 days, you can stay home 5. Okay. The other issue, of course, is quarantine. So you're not sick, you haven't tested positive, but you've been exposed to somebody who's been sick. And again, these numbers can really go up astronomically depending on the situation. This is what's caused a lot of problems in our schools, etc. So we keep fine tuning this to try and minimize the amount of people who will be walking around infectious. And at the same time, not keeping a ton of people home. So the new CDC guidelines have said that if you're fully vaccinated with a booster, um, and or completed, I think they're including a completed series without a booster, quarantine can be waived, and this is not unlike what we've said before. However, we used to say quarantine was a full 14 days. Now they're saying 10 days is adequate to self-monitor, and wear your mask. Now, even with fully vaccinated people, we're still asking for a test at about day 5. So that reassures everybody that you may not have an asymptomatic infection, which, by the way, with Omicron appears to be about 40% rate of asymptomatic infections. That's a lot of people who could be infected and shedding, and not really being very symptomatic. So again, test, test, test. The other part of the quarantine is that if you're not fully vaccinated, or unvaccinated, and you haven't been boosted, we still want you to quarantine. We want you to stay home for 5 days and then continue to mask for 10. So, again, that quarantine period has shrunk from the ideal 14 days. But if you remember, we've been talking 10 days for a while. So, this doesn't really change things other than officially we're saying 10 days is fine. And after 5 days, you can cautiously go about your activities. We do want you to test again somewhere around that day 5, 6 mark. And if you are a critical infrastructure worker, if you are a student, that we want to keep students in school, if you have access to testing, we can allow you to continue to function in society fully masked, but with testing on a regular basis, what we call serial testing. And that's in the fine print at the bottom, just for the caveat that that's really only expected for people who absolutely need to remain in the workforce, our healthcare workers, our first responders, etc. So again, nothing really new. But that quarantine period officially being shrunk down to 5 days at home, with the remainder 5 days being very cautious about exposure. So did I cover that okay? Nancy, did I cover that okay?
You did. A question did come in, but before we do that, did we go over the talking points yet? Are you
Because they
done with
fit
the
in with
data?
that, and thank you. Because
Okay.
I keep saying mask, 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 and a mask is only as good as the mask and how often you wear it. So when we say a well-fitted mask, and you're going to see a lot more language in the guidance, a well-fitted mask, that means there should be 2 or more layers if it's a washable fabric mask. If it's one of these paper masks, it should have the little metal thingy on the top that can squeeze around your nose. There shouldn't be a lot of gaps on the side. If there's a lot of gaps on the side, it probably doesn't fit you right. And it should, of course, be over your nose and your mouth so that it completely covers your breathing in and out. So that is a well-fitted mask. And if you have high concerns, there is some literature to suggest a double layering of mask is even better. So having a disposable paper mask and then throwing over a more stylish, comfortable paper or cloth mask that you have to wash. But see, the paper masks are nice because you can throw them away. So it's kind of a nice combination of disposable and fashionable and comfortable. So that is the mask issue. And then a lot of questions are coming in about Omicron and how is it different from the Delta variant. So let's just go and say right off the bat, we have Omicron now officially in our community. Newsflash: the positive cases that have been reported to us, really in the last 24 hours, all of those samples were collected before Christmas. Okay, so a highly contagious virus where most of the people I'm seeing aren't being really particularly careful. We can assume that Omicron very quickly is going to be our dominant strain. We'll let you know when that shift occurs. Right now, we probably still have a fair amount of Delta, but Omicron is here and it's with us. Okay, so the next big question is, you know, what do we do next? So we'll watch it. Now, how is it different besides being much more contagious and potentially less responsive to some of our monoclonal antibody therapies and perhaps more easily to break through previous infections where you develop some immunity? It's also less, the vaccines are less effective with a two-dose series, which is why we're encouraging everyone to get boosted. Because with the booster, it seems to go back up into that 70%, 80% mark, where without it, the vaccine immunity seems to be much less with Omicron. Likewise, the symptoms seem to vary a little bit differently. We've all heard it might be a little less severe. There doesn't seem to be as much of the loss of taste or smell, and but still a lot of the cough, fatigue, congestion, runny nose, that whole upper respiratory thing. So besides that, I can say you really can't tell what variant you have based on symptoms because there's an absolute complete overlap between them. So the main thing is to get tested. We are not sending all of our specimens in to tell which variant it is. We have specific criteria of which ones to send up to the Bureau of Labs for to do the genetic sequencing. But the reality is we're going to rely on epidemiology to tell us when we've crossed that threshold from primarily Delta to primarily Omicron. And if you don't understand what that means, that's all right. It just basically means we're going to rely on the science of epidemiology and the transmission of this infection statistically and through modeling to know whether we're at that point that most of our infections are more likely to be Omicron. Okay,
Okay.
stop.
Going into the questions, there was only one question that came through email, and you've pretty much answered this, but there was a second part of this question that said, what is the rationale behind reducing isolation? You can just kind of cover that again,
hmm
other than people missing less work.
Yeah, and it really boils down to the science. And I think I've spoken to this as well, that it's very clear that the lion's share, the majority of this viral shedding occurs, unfortunately, even before the onset of symptoms, 48 hours prior to when most people even recognize they're ill, which is why it's been so tricky to control. Beyond that, 2 to 3 days after symptom onset. So that early part of isolation period is where the majority of people are shedding most of the virus. And so when when you have the science that's kind of accumulating that this is the highest risk time, we are well beyond the stage where we're trying to stop transmission of this virus, right? We're just trying to reduce the impact, reduce the load. We call it mitigation of harm, which means that we're not trying to stop all transmission. We're just trying to stop the majority of it, which means we need to focus on when the majority of the virus is shed, which is that beginning part, that first 5 days. So I think it makes a lot of sense. I think it's been a long time coming. And there's a point where we just have to find that balance between not letting this whole thing run amok and completely overwhelm us and realizing that we're living with this virus and it'll continue to be kind of part of our radar for a long, long time to come.
Okay, let's get to the questions that are coming in during the live. Let's start off with Shelley. Can COVID affect an unborn child?
COVID infection does appear to have some impact on pregnancy, although I have not heard that COVID is affecting the baby as much as a mom that's carrying a baby that's not getting enough oxygen can obviously have a profound effect on the well-being of a child. So the COVID infection in a mom doesn't appear to be having the direct infection problem with the unborn child, but the mom's condition can dramatically impact the well-being of the baby. And that's how I am understanding the risk of pregnancy and COVID. Plus, there seems to be something about the immune condition of a woman. So when women have babies, their immune system changes, right, to accommodate the fact that we're growing um, this unique individual inside of us. It's kind of a miracle. So our immune system is suppressed during pregnancy, and that seems to be creating as well some increased risk for pregnant women. They're more likely to have a more severe infection when they get infected with COVID. So that's where the increased concern for COVID and pregnancy is really coming from. I think it's from the impact on the mother, and that has obviously a dramatic impact on the unborn baby.
Okay. Question number 2 from Rhonda. Do you think colleges will return to in class, like on
That's,
classes?
like everything else, we're sitting here, um, almost like what do you call reality TV, watching this virus kind of unravel in front of our eyes and trying to decide what the heck we should do next. We do know we do know that in classroom settings, if you're very conscientious about masking, ventilation, distance, removing people who are ill, that there's certainly the ability to kind of limp along and keep classrooms going. When you get things out of control, pausing is sometimes the only real way to kind of calm things and stabilize things back down again. But I think each school, university is going to have to look at that situation as well as the epidemiology at the time and their community. The problem with colleges, right, is they get students from all over. When we're dealing with our schools here locally, most of our students are coming locally. So we can apply our epidemiology that's happening right here to what we should be doing with the schools. And colleges have a whole different level of problems to deal with. So do I think they should or shouldn't? You know what? I'm just gonna kind of focus a little bit on more on our local community. I do think people need to continue to take this seriously, but again, find a way of balancing transmission, even high transmission, with living our lives. And that balance, I think, is going to come with some sacrifice, but a complete shutdown, I don't think is something any of us want to see happen.
Okay. Next question from Sue. Do they have a test to tell which variant?
Kind of at the Bureau of Labs, they can do this. So there's genetic sequencing, and there's some tests that PCR tests is complicated stuff I was reading about last night, and honestly, I don't think I can explain it well. But there are ways of telling in certain kinds of tests if it's a variant or not. With that said, you cannot tell the difference with a rapid antigen test. Okay. You're not going to know that. And the lion's share of molecular tests, if you are getting a molecular test still, you're not going to know whether it's a variant or not. So as I mentioned earlier, we notified of variants weeks later because that's how long genetic sequencing takes. It takes a week of sampling. It's not the same test that we do to identify a positive or a negative. So realistically, we are going to be saying to you, this community, you have Omicron more than likely once the threshold is reached where the majority of the sampling is positive for Omicron, and we'll realize that if the sampling is there, it's likely there in all cases. And that's what we're just kind of like we did with Delta. Remember, we notified everyone that Delta was here, and once it reached a certain threshold, we stopped looking at the differences, the variants, because we just knew it was all Delta. And that's going to happen with Omicron. It's just going to happen a lot faster. It's going to happen really fast because what we're seeing is it's not taking weeks or even days for Omicron to double. It's really a very short, very quickly transmittable infection. So I'm thinking perhaps even as early as next week, we'll be seeing reports that tell us where Michigan is and where our county is when it comes to that.
Okay, next question from Yvonne. Are staff, including doctors and nurses in physician offices, required to wear masks?
Yes, I've said this before. Yes, 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 they are.
Okay.
How's that
Next
for short and
question.
sweet?
Yes, that one is short and sweet. Next question is from Heidi. Are managers of a company supposed to contact the health department when an employee has COVID? My boss was wondering.
We like it when you report it to us because it helps us keep track. As I mentioned before, there's a lot of testing going on that we may or may not get word of. So it does help us keep track. It helps us as well support you if you need help with wading through all these quarantine and isolation guidance. But your employer is actually required by law to tell the people who've been exposed. Okay, they're not required necessarily to tell. Well, it is actually a reportable illness, but it's a reportable illness from the person who's sick. So it's a courtesy. But they are really what's really important is that your employer notifies the people who may have been exposed as a result of that workplace case. And that's really the important part of this. It's not about keeping track of who's doing what. You know, government knowing what's really important is that the people who need to know are notified in time that they can change their behaviors in ways that can protect their loved ones and their family members, right? So the sooner people are notified that there was an exposure, there was someone in the workplace, the employer does not have to say who it was. All they have to say is, as we have identified a positive case and we believe uh, your exposure there was involved. So yes and no. It's kind of a non-answer. We'd love it if they did report it. It is a reportable illness when they know, but what's more important is they tell the people involved.
Okay. Um, this next message is from Kathy, and I know people are coming in and at different times in the live, and I know you already addressed this.
It's all right. That's what we're here for.
I think it's just good for just to hear it more than one time.
Right.
Just
And every
go over
time
it again.
I say it a little differently too, right? So maybe that's helpful too. All right. I'm saying the same thing, but I try and say it in different ways so that it makes sense to everyone. So go ahead. I see it.
Okay. A person got sick one day after getting in direct contact with a positive case. When should the sick person get tested?
As soon as you get sick, if you are in fact having symptoms, the assumption is that that virus is replicating rapidly enough to make you ill. Okay, so if you're ill and you've tested negative and you know you're a direct exposure, what we ask you to do at that time is either retest a couple days later or we do a confirmatory molecular test, right, which is a little bit more accurate. But remember, I said the majority of times when people start replicating virus, it's actually before they even get sick. So, there's lots of discussion about, you know, so is the person you were exposed to yesterday, is that really the source of your infection? Or was it the fact that you were both exposed to the same person a few days ago and your symptoms just started a little bit after theirs did? So you see, there's a lot of nuances to this. But to answer your question directly, you should get tested as soon as you get ill. The longer you wait, the longer you delay that information that can be so helpful for other people.
Okay.
And if I'm just going to morph into that, the longer you delay, the potential longer you'll have a delay in receiving treatment that you might be eligible for. And we're going to go back to the fact that monoclonals at this time are still highly effective. In fact, if we get when we get into Omicron, there is still a monoclonal that's found to be very effective. We'll just have to switch over to that one only. And we have now the new oral antivirals as well, which I don't know when they're going to actually be physically available to us, but they should be coming soon. So it is important to test as soon as you feel you might have COVID.
Okay. The next one is from Erica, and I know, Doc, you already answered this, but um, why did they change the guidelines? Just maybe
And
short and
grow,
sweet.
growing scientific information and changing needs of our county and our community and our country. So it's this is not a static epidemic or pandemic. It's changing constantly, and what we need as a country changes as well. So we need people to work. So we've done that, and we have a lot more information about the nature of the virus. And expect it to change again, people. I know everyone thinks that change means we don't know what we're doing. Change means we're paying a lot of attention to what's happening and we're adjusting as we learn.
Next question from Darlene. Why is Michigan worse in COVID cases than a lot of other states? What
You know,
are they doing? Oh,
yeah,
go
it
ahead.
seems that way. And I think in time we will be able to compare some apples and oranges as far as policies and all these things that we're trying to do to reduce the harm of this virus. But please understand, so when Michigan's up, if you look at the state maps, Michigan might go up, but then so would another. So Michigan was up for a while. Now the states around us are up, right? We're coming down a little bit, and we got, I think it's Wisconsin and Indiana or Illinois that's really hot. So it's really, I think, the nature of this virus. It doesn't affect the entire region in an equal way. It kind of attacks in pockets, and then it spreads from there outward, and then it moves on. So if you remember in the summer, the South was really hot, right? So you could say, well, what's everyone wanted to point to Florida and say, oh, look what Florida's doing. It's just I think there's a component of the nature of the virus. It tends to start out in a little hot spot and then expand regionally and then burn itself out, and then you'll see it start up in another area. So I don't think Michigan's doing anything terribly wrong, although I have to say I do think we could be a little bit more conscientious about trying to reduce spread through masking and social distancing. It doesn't seem like we're really focusing on that as much as we should.
Next question from Heidi. I was wondering if a person has a fever with COVID, is that when the virus is shedding the most?
That's a great question, Heidi. And there's some theories that fever might indicate a high level of viral burden. But I honestly can't tell you. I know the answer to that for sure. More to come. As I've already indicated, there's a lot of people that shed virus with no symptoms at all. So, but you do tend to get fevers early on in the course of a viral infection, right? So, I've also said that we know that most of the virus is shed early on in the course of this infection. So that does correlate a little bit. But I think it's more important to remember that you're more likely to be shedding virus at the very beginning of your infection, right after your exposure and just before your symptoms begin.
Okay. Next question from Donna. When you test positive, do they tell you if it is Delta or Omicron? Are their symptoms different? I know you kind of covered this
Mhm.
before.
Symptoms may be a little different, but like everything, it's not going to be consistent enough to base your symptoms on what variant you might have. The virus just doesn't impact everybody equally like that. Although at a population level, we are seeing that there's differences in symptoms between the variants. But you as an individual sh- really shouldn't be trying to differentiate. You have one variant over another based on your symptoms. It's just not that simple, and it wouldn't be that reliable. And to answer your first part of your question, when you test positive, will they tell you no? Because our standard tests that you either get back in 24 to 48 hours, or the rapid testing we do doesn't tell the difference between that. The difference between Omicron or Delta is generally coming to us, as I mentioned earlier, um, weeks later. Weeks later. So we have to approach this assuming the worst, right? Assuming that you may have the most highly transmissible variant. If you're getting infected right now, there's a good chance that Omicron is in that mix. And you're not going to know about it perhaps till well beyond your isolation period. As I mentioned before, the Omicron variant notifications that we received today and last night were with samples that were taken the week before Christmas. Okay, so we can't rely on testing for that immediate piece of information. We have to use our heads and just assume that that epidemiology needs to guide us.
Okay, next question from Sue. The vaccinated people can carry it and spread it, and they can go out in public when exposed, but test after 5 days. If it is positive, how many people did they infect in that 5 days?
Sure. Well, I just said our goal is not to stop transmission, it's to reduce it as much as possible while maintaining our functionality as a society and as a community. Vaccinated people are much less likely to get infected. I believe it's 4 to 5 times less likely to get infected. So you have that. In addition to the fact that if they test on day 5, they should catch it after exposure. They should be catching that positivity very early on in their transmission rate. So it's a compromise, which allows people who are much less likely to get infected to keep functioning. And as you said, we have adjusted now where quarantine for even unvaccinated people is much less restrictive. And also just remember that if you're vaccinated, and this has got nothing to do with your question, but it's a great point to bring it up. If you're vaccinated, you're much less likely to get severely ill, 14 times less likely to be hospitalized and die. So we have a lot of evidence to support the value for vaccine, but in no way, you're right. In no way does it completely eliminate the risk. It's just a compromise because we know the risk is much lower in those individuals.
All right, next question from Erica. What happened to the flu? Haven't heard much about it since COVID.
Well, it's here. Last year was a very, very light year, and everyone was like, "Hey, this year we're watching it. I think there's some high transmission in a few states. We're starting to see some reports coming in, so I don't think we're off the hook with influenza. Now, influenza tends to start in January, February, and peak around then, March, April. So this isn't typically when our highest rates of influenza are yet. So we'll just have to watch that carefully. We have influenza surveillance systems as well. So we'll have a sense when those rates are starting to go up as well. And hopefully they
Okay.
won't. We'll see.
There was a question from Yvonne, and I think at the time that it came up, um, it was possibly regarding, oh, here it is.
Don't.
What if they don't and they discourage the vaccine? I wonder if they're
What if
talking about the physicians
what if they don't? Oh, our
to wear
physicians?
masks.
What if they don't? It's unfortunate they're not following the science then. And eventually the science will catch up to them. And I would think that we'll all eventually get on the right page. Um, I would talk to them if they don't really want to follow the science. You can talk to us. We do have conversations with our doctors on a pretty regular basis. We send them literature and information and guidelines to hopefully urge them towards the overall consensus that has been reached. All we can do is try. And if ultimately you have a physician that's advising you to do anything that you feel is not appropriate, you do have the right to seek a second opinion.
That's a very good point. Moving on to Christine. Okay, this is a couple of questions. This is regarding requirements for private pay nursing homes as far as testing and reporting positive cases of their residents and staff.
What are the requirements for long-term care facilities? Boy, it's changed so many times. I'm struggling with that too. Christine, could you send me through COVID-19, our COVID-19 email, COVID-19 at stclaircounty.org, this question? Because honestly, off the top of my head, I can't remember what the requirements are right now. Um, yeah, they're required to report. I do know they're required to report. And they're certainly required to report to exposed individuals. I just can't tell you, um, I can't tell you the details of what they're supposed to do with staff. That's my problem. I can't remember the staff. So I'm going to get back to you about that. Well, okay, let's just say what's the right thing for them to do? The right thing for anyone to do, regardless if you're working with a high risk population or not, but particularly if you're working with a high risk population, because remember, the majority of people who die are still the elderly. Okay. The right thing to do is to be sure that you're not infected when you are in that environment with those people. And the way to be sure you're not infected is to test and to wear appropriate PPE, right? And as soon as you identify that you're positive, you should not be working with a high risk population. You should be isolating, as we you talked about earlier. Now the isolation is a lot easier. You should at least not be isolating for at least 5 days before you come back to work. So that's what should be happening. If it's not happening, urge them to call us and we'll walk them through those guidelines. What they're required to do by law is a lot of googling up in my brain right now. There's a lot, as you guys know, there's the OSHA requirements and the MyOSHA. So I would have to check what the current requirements are, but that's what
All
they
right.
should be doing. Okay.
And we did provide her that link to go
Thank you.
to email those questions to you. Next question is from Lori, and I just want to be mindful of our time. It's 4:06. We have one, two, three, four more questions, so we'll keep on
That's all
going.
right. Sure. That's all
Okay.
right.
All right. Lori's question is, what type of mask is the most effective?
An N95 mask has been fitted. Okay. After that would be an N95 that's been unfitted. Do we have an N95 here? It's the round ones that fit differently. They're much more uncomfortable, okay, because they block a lot more of that airflow. I would say after that, there's a lot the jury's out. Um, and I think after that, it really depends on how well you wear the mask, how consistently, and how well it fits. Okay, so if you're really serious, you can wear an N95, but you're not going to be able to use it for prolonged periods of time. It's really hard. This is what our poor healthcare workers are delegated to, and you've seen those pictures. And it's just hard on them.
Okay. Next question from Virginia. With so many tests that are done in home, how do you keep track of the results of those?
You don't. We don't, right? Obviously, if some of them get reported to us, we put them in our system. If they go get a confirmatory test at a lab, that would go into a system. But obviously, the at home testing is not being done for the purpose of surveillance. The purpose of at home testing is so that you, as an individual, know what to do with your disease, with your body. Okay. So there are two different reasons to test. One is for surveillance so that public health can understand the epidemiology, the disease in the community. And then there's the purpose of testing for your individual healthcare needs and to help guide you with what you should be doing. And so really the value of those in-home testing, those over the is for you to know. So you do a test tomorrow, please don't go to grandma's house this weekend, right? Don't have your New Year's Eve party. We're having a few son daughter things come together this weekend. They're all going to test before we get together. And we have to be prepared that if any of those tests are positive, um, plans will change. So that's really the value of testing is to guide you with your behavior and with your own treatment and management of your own body and your own disease.
Okay. Next question is from Bud. And part of it is the question is from Charles on Bud's page. Is J&J still an effective vaccine? My wife just got her booster for the Johnson & Johnson. Should she get the third shot soon? And should that shot be Moderna or Pfizer?
So is the J&J still effective? Not as much, although I think we're still going to play the numbers game for a long time. I don't want to discourage people from getting a vaccine, but I would encourage, if given a choice, to get an mRNA vaccine. They seem to be holding up a little bit better with the variants. So if she just got her J&J booster, oh gosh, I gotta think. Does she need to wait 2 months to get her mRNA? I think she does. Another little detailed question that I need to look at. I think she needs to wait, but I would suggest her next booster be an mRNA vaccine because it does seem to be holding up better. So, Charles, that would be another one. If you could shoot us through that email, I think she, I think she does have to wait 2 months now that she's received the J&J. But I have to check that again. It's changed a little bit.
Okay, next
Okay.
question from Paul. The state lists deaths from vital records review, which means they aren't from the time period presented in the website. Are any of the deaths added to the county count deaths from vital records review, or are they all within 1 day time frame?
This is a Brandon question, but I don't believe they go on our website until they have been vetted and reviewed by Vital Statistics. So many of the deaths that we put on are pretty delayed. They're deaths that occurred weeks ago in many cases. So we're not adding deaths to our website based on a phone call from the hospital, okay, or a phone call from the medical examiner's office. We wait till those death certificates are fully vetted and then sent to us. And Brandon, if you're listening, um, give me a quick email if I'm wrong. But I know that we don't. We are careful when we put deaths on it because we don't like to subtract those deaths. We like to only put them on once we're comfortable that they're COVID related.
Okay, next question. And sorry, Kimberly, that we missed your question earlier. I'm just waiting for that to come up because it's multi-questions. Kimberly. Oh, there she is. Will ages 15 and below be approved for booster anytime soon?
That's a great question. There's a lot of discussion about that because the booster is intended to reduce severity of illness, more so that it's intended to break the transmission completely of the infection. As we know, younger people have much less serious infections, and so you have to weigh that with the risk of the vaccine, which, although small, is real, right? So I've been hearing a lot of pros and cons on that. I don't follow all of those meetings with the ACIP. But my sense was that it wasn't coming through the pipelines very quickly, that there was a lot more debate about the value of boosters in younger individuals. But if the CDC announcement yesterday has proven anything to me, is that sometimes what's on my radar, it has nothing to do with what is going on at the national level with some of these large advisory committees. So stay tuned. I can tell you the epidemiology will impact that as well. So depending on how many kids are actually getting sick and how that's impacting our um, our environment, our world, might impact that booster decision as well.
Okay, next question from Dina. How effective are the at-home tests compared to the test at urgent care or, even the health department? Is there certain brands of an at-home test that you recommend?
So on the FDA website, they have a whole list of tests that have been FDA EAU approved, right? Emergency authorized. And those tests are generally considered reliable. If you buy something that's not on that list, I can't even tell you. Who knows? Maybe it is, maybe it's not. In general, home tests might be more susceptible to false negatives, which is I kind of brought up earlier. If you're highly suspicious that you have a COVID infection because of your exposure history, etc., and you have a negative test, act as though you're COVID positive and repeat the test. Okay, either repeat it within 24 hours or wait a couple days and repeat it, so that you have that backup. Because it's more likely to be a false negative than it is a false positive. And I don't know what each urgent care is using, but I know our hospitals and most of our hospital systems are using the FDA approved COVID tests. And I'm quite certain if you go into CVS and buy them off the shelf, they are FDA approved. But if you buy them online off over the internet, I I can't tell you. Who knows? I'm sure it's the wild, wild west out there. People trying to sell COVID tests. So be careful. I would go to the FDA website and match what test you're planning on purchasing with what's on there.
Okay, next question is from Sebastian, and you answered this. This was very similar to the question about the J&J. The last part is what you kind of already
Yeah,
answered,
and I would say, yeah,
encouraging.
you should go towards an mRNA vaccine next. What I got to double check is what the interval is from the if you got a J&J booster, what the because remember we're still not recommending another booster. We're still at that get one booster kind of thing. So some of you are way ahead of the game, but we have a very small percentage of our population who's even been boosted. So that really has been our focus. If you're going to seek out a booster at this point, I would suggest getting an mRNA booster as opposed to the J&J booster. If the J&J is the only thing you can get it. But I think the others have been showing a little bit better track record with the variant.
All right, that looks like our final question. It is 417. Any closing remarks?
Hmm. Happy New Year, everyone. Hang in there. Do the right thing, and we'll just keep walking this walk with you. We're in this every step of the way, and I just appreciate the time that you take to ask these stimulating questions. And I am sorry I was a little less prepared today with the holidays, but a lot of changes, and we'll just make sure that we follow up with you. So thank you again. Next week is Thursday, and we'll start our Facebook lives on Thursday at 3:30 from then on again, I believe. So thanks for
Mhm.
adjusting our schedules.
Yep.
Bye.